I'm Josh. I like staying active and exercising, but lately my knees felt really wonky. I've tried ice, I've tried heat, I've tried painkillers, but man, it still hurts. I think it's time to find somebody to help. I think I know just the person. Follow me. I'd like all of you to meet Aaron, a physical therapist here at Osborne County Memorial Hospital in Osborne, Kansas. Hi Aaron, thanks for joining us today.
Hello Josh. Hi everybody, we're glad you're here. Josh, would you like to take a tour of the physical therapy space and we can talk while we walk?
I'd love to. I'd also like you to take a look at my knee.
Okay, let's do both.
All right. Wow, what a cool clinic you have here. I think the best way for us to start is for you to explain exactly what physical therapists do.
Physical therapists treat patients with illnesses, injuries, and other impairments that impede their ability to move and function. I put together treatment plans to help patients manage pain, reduce inflammation and swelling, and build strength, balance, and endurance. Everything I do is customized to help patients overcome whatever problem they're facing and prevent future injuries.
Wow, that's a lot. Let's break it down a bit. What types of patients do you work with?
Here in a rural hospital, I work with anyone and everyone who needs physical therapy services. This includes people in the community dealing with pain or an injury, patients in the hospital, and patients who have been recently discharged and are now recovering at home. I work with people for weeks, months, or sometimes even years as they recover and grow stronger. My patients are all ages, from babies through senior adults. However, some physical therapists specialize in working with specific types of patients, such as children with disabilities, people recovering from orthopedic surgeries or injuries, athletes, or even senior citizens.
How do you know what type of treatment your patients need?
I start by reviewing the information the referring provider and patient give me. This can include a description of their symptoms, and if it is an injury, how the injury occurred. I'll look at whether the person is taking any medications and is already undergoing treatment, like wearing a cast or brace. I'll also review any tests and imaging, like x-rays, that were done to diagnose the source of the problem. Then, during the person's first appointment, I'll take a bunch of baseline measurements to evaluate where they are today, so I can continually measure their progress as their body heals and gets stronger. Okay, would you like me to take a look at your knee? I'll show you some of the baseline assessments we would check on an initial evaluation.
Yes, please. My knee's been bothering me for weeks.
Okay, let's go.
Aaron assessed my knee to see where my pain was coming from and my movement patterns to see what structures are irritated.
You have discomfort in this area?
Yeah.
Yeah. Patellar tendon. Yep, that's it. There it is, patella tendon. There's a lot of ligaments in the knee.
Then Aaron gave me several exercises he wanted me to do most of the days of the week.
Good, start with that foot in front. Oh, like that? Yep, and then you're gonna drive backwards, kind of like you're almost taking a step backwards. Yeah, there you go. Yep, squeeze that quad nice and strong. Good, there's 2, 6, 7. Yeah, there you go. Good, give me a good athletic stance. 5, 6, and 7. Oh, very good. After a few weeks of doing those exercises with me here in the clinic and on your own, I'll repeat these assessments to see how much progress you've made. I'll probably give you some additional exercises as you get better, too. I will send a report to your doctor and your insurance company about my findings and the treatment plan. We can use lots of other techniques here in our clinic, such as therapeutic or diagnostic ultrasound, dry needling, or hydrotherapy. I choose the techniques based on the person's condition, symptoms, fitness level, and age.
Wow, Aaron, that was so cool. I had no idea physical therapists did stuff like that. And I can tell you have a great relationship with your patients as well.
I certainly try to. I'm originally from Osborne, so this job is a homecoming for me. I am very grateful that the people of this community help prepare me for success, and this job offers me ways to give back to my hometown. It's very rewarding.
What made you go into physical therapy?
When I was in 7th grade, I had a wonderful science teacher, Mr. Walters, who taught us the muscles and bones in the human body. I thought the human body was so amazing. I was hooked. In high school, I had the opportunity to job shadow a physical therapist. And through that experience, I got to see what it was like to work with patients from 6 months old to 106 years old. I liked it so much that after I graduated in 2009, I decided to major in pre-physical therapy at the University of Kansas.
Rock chalk, boom! Then what?
After I earned my bachelor's degree, I applied to and was accepted into the University of Kansas Medical Center's physical therapy program, which is very competitive. I spent 3 years in that rigorous program, and then I finally graduated in 2016 with a Doctor of Physical Therapy degree.
How did you get this job here in Osborne?
This job came about after I was working for a year, and I couldn't pass up the opportunity to come back to my hometown. It was also a very cool opportunity because I got to help this hospital design and set up its first in-house physical therapy program. I love that rural hospitals give you the opportunity to do lots of different types of treatments. There's always more to learn, so while I've worked here in Osborne, I've taken advantage of many opportunities to learn new skills.
You sure do a lot of different things, and you're a high school coach on the side.
Yes, I was a wrestler and a football player in high school. So another way I can give back is by helping with sports in my community. I'm an assistant wrestling coach, and I help on the sidelines during football season. I love that this job allows me to be community-minded and get to know my patients and their families outside of the hospital.
As somebody who works with high school students, do you often find yourself giving advice on how to start a healthcare career?
In high school, I recommend that students prepare themselves by learning how to type and taking as many technology classes as you can. You should try to take and do well in your science and math classes, as well as any healthcare-related classes your school offers. Once you're 16, I suggest you earn your Certified Nursing Assistant license. Try to get a job in a nursing facility to see if you like working with patients. Also, if your school offers any clubs related to healthcare, like HOSA, get involved with those. I strongly suggest that you find a physical therapist to job shadow to see if you think this is something you really want to do before you commit to going clear through to your doctorate.
You've helped me realize that physical therapy is about more than I could ever dream. I love the way you help people and the variety of all the things you do. Thanks to Aaron and everybody here at Osborne County Memorial Hospital for giving me this great overview of an important career. I can't wait to get home and try out these new exercises with my knee. I'm sure it'll be feeling better in no time. To learn more about high-demand jobs in Kansas, visit HirePaths.com. Until next time, this is Josh, signing off in Osborne for Cool Careers. Have a great day.